So today I was asking a question as to whether you should get blood testing and a health check as early on as you possibly can within life. And I always thought people would agree with this sort of narrative that the earlier on that you spot disease, the better it is to treat it. But apparently not. So that's what we're going to discuss today. I'm going to do an upper body workout. So we'll go through a few of them things whilst I'm doing it. Starting off with upper chest. I'm going to do 80 kilos, no leg drive, and then I'll come on to it. That wasn't too bad actually, could have went for a bit heavier. But yeah, so obviously disclosing everything early on, I do own and I have opened up a private blood testing company, but that wasn't the reason for that. I worked in healthcare now for over 8 years, and the way that we treat healthcare within our society, within the UK, maybe in the Western culture in general, is reactive. We wait until someone's had an event before we actually decide to do anything. And there was a couple of people who was arguing their point on the platform I was discussing it, and they were saying that they worked in healthcare, and they said that there's no guidelines, there's no evidence for testing when you are in a normal range, which there won't be any guidelines because the public and the population are set up to, well, the public are very unhealthy. So why are we going to make guidelines for people who aren't going to conform to what we want them to do in terms of preventative health? They are literally going to keep going about their life until they need medical intervention, and then that's where the guidelines come in. Let's treat disease when it first appears. So that's where I thought their point sort of fell short, was that because it's not in guidance and people are still classed as having a normal range, I just don't feel like that was good enough. And I did end up with a line saying, I'll let you treat your patients when they're sick, and I'll stop mine from getting there in the first place. I feel like that was the best way to put it, because an analogy that I used for them was that you fill your car up, you've got a fuel gauge, and in their concept, you just fill it up, and because it's okay on one day, you just keep going until the next time you put fuel in it is when it breaks down. Whereas mine is, you check the fuel gauge, you know that it's going within a certain direction, you go, well actually, there's a good chance I might need to put more fuel in it. And I don't know why they couldn't understand that concept. But then I did say to them, I feel like beforehand, when I was heavily within the NHS and the hospital systems, etc., that I probably would have conformed to the same guidelines. But after seeing the bigger picture, seeing what happens politically and all these other things, and just from a logical point of view, it's obviously not how I practice going forward, but I'll get onto it. 100 kilos, aiming for 3 to 4 clean, well, reps without any leg drive. So let's see what happens with that one. Leg drive is actually a big thing in bench press. That wasn't too bad actually. I have to be a bit careful with the mic, so don't go too far down and squash it. So one of the reasons why I went with this topic tonight was I was looking at social media, and a few people asked like what was my goal with it. Is it to be an influencer and all them things? And it's not. Obviously influencer is not the nicest term, even though there are some really good people who do it. But it was more to draw a light on the business ideas and the things that I want to do in life. So like I said before, I've got a blood testing company. I've also got an online health community, and I want to try and draw more attention towards that. But at the moment, I just feel as though the public, especially the age that I'm targeting, so I am targeting people who are probably 25, 28 up to about 35. Obviously, anyone over the age of 18 all the way up until later stages of life will benefit greatly from the information that I give out. But again, it's all about who would maximise or get the most return, and I think it would be that age group. And it's just quite a hard topic to get across to people, that even looking at me now, so I disclose everything with my bloods, but my biochemical data and all the results that come back are pretty poor in some of the genetic markers. And just because you look at someone physically and say, oh, well, they can bench this, they look like this, they can run a certain pace, that it disregards all the other aspects of health, when in reality tomorrow or the next week I could probably have a heart attack. And that's when obviously everyone has the eye-opening realisation when footy players hit the deck, sadly obviously when they have different types of cardiac disorders, but still they are having health inequalities due to other things that are going on beyond and besides the physical appearance. So that is what I am trying to drill home to people. So I just thought I need to start going about it in a different way. So I will go into it, like I said, after this set. This is heavy seated rows, which I haven't done for a while. So let's see how good I am at these. Oh, that feels quite heavy. Obviously 11 reps there. I could have went a bit heavier, but there's not much more weight on the stack that would allow me to do that. But yeah, so that's why I got into preventative health. One, because when I got diagnosed in 2004, 2005 with a rare form of diabetes, and I wasn't saying at that point I went into it by all means, but I then was under annual surveillance. I was under frequent surveillance at that point, when I was going through diabetic testing for every day for about 3.5 weeks, 4 weeks. And then that continued for a high frequency really, because they didn't really know what I had. And I think they were scared that it was type 1 diabetes, given my age. But I continued to be under surveillance, annual monitoring, up until the age of 23 it was. And then they discharged me. Apparently there was a lot of evidence from the University of Exeter saying that the type of diabetes I had didn't have any more complications over the generic population who don't have diabetes. And what that means is people who are diagnosed with diabetes tend to have a higher risk of eye disorders, kidney disorders, cardiovascular disease, peripheral neuropathy, so it's basically nerve pain. And yeah, because I was now increased risk over the general population, they discharged me. I then, about 3 years ago now, I went into hospital, had basically a colitis, stress-induced in the end, funny enough, even though I know it's one of the pillars to health. And I just asked for my bloods, got a full blood screen whilst I was there, and I said to them, what can I have the previous history so I can have a look in terms of what my trend was. And there was a result back when I got discharged of 51 for my diabetic score, which is clearly diabetic, and there was no information passed on to me. There was nothing. And if that was left untreated for a long time, I was at risk of a lot of things. So it just really drilled home to me that a lot of people are not getting the right amount of care, and we are not treating it properly within Western civilization. We are waiting until something happens. So that was where a lot of the passion come from. So I will go into a bit more now. Second set of these, probably aim for about 10 to 12 again. So going back to that person's comments that there's no evidence, you shouldn't be doing this until you become sick, basically. So the proof behind it is that if you look at a lot of conditions, so I'll take type 2 diabetes as the main one, is that you can clearly see metabolic dysfunction 10, 15, 20 years before that manifests on average as type 2 diabetes. Same with heart attacks. There's evidence that there are fatty streaks within the arteries of 5-year-olds. How do we know this? There's autopsies done, sadly, when children pass away in car accidents. There's autopsies done from when people are in war and the teenagers. So there is a lot of evidence going that way. So to wait all the way up until you are type 2 diabetic or you have had a heart attack to then intervene just seems absolutely ridiculous. We don't do that in any other aspect of life. We don't do it with your house. So you can see, I don't know, potentially that the roof might need repairing. You don't wait until the whole house is flooded before you then go, do you know what, I might put the roof on. And why do we do it when it comes to health? So like I said, if you want to pick type 2 diabetes as the main one, so the marker that we use, HbA1c, you might have it. So in America, we do by percentage. So it's 6.5%, etc. In the UK and a lot of other European unions, we do it by millimoles per mole. So the value that we're looking at is a value of greater than 48. Now, if that is exceeded, you are then classed as diabetic. Now, once this happens, you've had years of high levels of insulin, and we can test this by doing other tests, such as oral glucose tolerance testing. Without going too much into the science and losing the whole point of this video, basically you can do a lot of things beforehand, see that it's happening, and that your normal results, which aren't normal because we don't optimize it, we just keep people basically out of a hospital setting, it might have this range, and your results could be going like that. So they're all classed as normal from here to here. However, you can clearly see it is going on an upward trend, and eventually, once it gets over that tipping point, you are then classed as having that disease or that condition. I feel like we should be intervening a lot sooner, and if a lot of family members I know would have had that information years ago, they would have bitten your hand off basically to have it instead of going through surgical interventions. But obviously there are people so well ingrained within the health system that they can't see how clear this is. But yeah, I thought that is the main topic of this conversation anyway. But the hardest thing is how people do a workout and discuss things whilst trying to maintain a conversation. Obviously you don't have any script, no music, and you've got to go in between each ones. So I'm going now onto a Y gripped shoulder raise. It's a bit different. You use the bench as support, and then you can isolate the medial head of the delt a bit more. Don't load it with too much weight. A lot of people ego lift. I've said that now, I'll probably ego lift. No, I'm not. I'm going to go for 7.5 kilos and see how that works, and then see if there's anything else to talk about with regards to blood testing and monitoring. Change the grip and make sure that I've got enough grip on it next time. Before we get into the next set, I think a good thing to go over is what should you get tested and how often should that be done. So in terms of what should you get tested, I believe everyone should get a metabolic screen at some point. That involves a full cholesterol profile. That also includes a few advanced markers, lipoprotein a, ApoB100, high sensitivity CRP. I think it should have HbA1c in it. I think you should also get your omega-3 index. I think you should get vitamin D. Vitamin D is something that I am looking into a bit more at the moment because we treat it quite often within the UK because we don't get enough sunlight. at least for 6 months of the year because we're too north of the hemisphere. But from a few things that I've been reading and listening to, we completely undertreat it anyway. And yeah, I want to optimize that. Same with all other aspects of life. So yeah, I feel like everyone should at least get one of them panels. And like I said, in terms of frequency, if you are 28, 35, within that range, if you get at least a couple within your fourth decade, so your 30s to 40s, you're going to do quite well because that's more than the majority of the public. If you want to be a bit better, get it at least done every 12 months. If you want to further optimize it again, stick to the 12 months, but then if you change something, for example, you change your dietary pattern from carnivore to ketogenic, or you go to vegan, or you have certain supplements, and you want to make sure that it's working or whether it's appropriate for you, then minimum period would be every 3 months. The only time you would go more frequently is if you are on medication that you're concerned about it being cleared by the kidney or affecting the liver, and you are under medical supervision. I don't feel like there is a need to go any more frequent than every 3 months, but it's all up to you. But for me, the more trend lines you have, the better you have in terms of data, the more informed you are making decisions going forward. So I feel like it's a no-brainer really. Right, with this one, make sure you are alternating your legs so you're not going to be imbalanced. Different grip this time. Like I've said before, changed the way I've trained completely. Don't normally do more than 2 to 3 sets at the top, just because I want to train every day. So I don't go all out on these things. And I mean, when I film workouts, it's not as efficient. So upper chest on the incline bench press, seated cable rows, side delt raises with the Y stance. I'll probably do some pull-ups, and that'll probably do me for tonight because it's getting a bit late. I've left it a bit late tonight. The last exercise for the night, I ended up doing a longer warm-up so I could get straight into it for filming. But I think I went over enough of why I believe you should be testing. This is not to pitch anyone, by the way. Don't go and do your own research. It's just to draw information from this video and make an informed decision. But in terms of this idea of normal and optimal ranges, I will go into it probably in another video, but I wasn't conscious of it when I was working within healthcare. So like I said, I've been in healthcare for 8 years. I've worked across all sectors: industrial, hospital, tertiary, primary care, community, and you literally just go off a guideline. So you've got governing bodies, you've got different policies. So depending on which hospital you work under, what jurisdiction in terms of whether it's Manchester, could be Liverpool, wherever, they've got their own policies, which it's quite strange really when you think about it, considering we are one health system. Anyway, you will then have different treatment targets, and as long as you conform to that area's treatment target and algorithm, you're basically supported by your insurance body if anything were to go south, essentially. But normally not many things do because the guidelines are pretty robust. The only thing about the guidelines that I would say is that they are to treat disease and to get you back on your feet in general. They're not there to optimize you. So an analogy could be if you were to do an F1 race, it's allowing you to finish the race, but it's not allowing you to be in pole position. That's basically what I'm trying to get at. So I didn't really notice this, that it was only when I was working across 2 different areas, so Cheshire and Merseyside and Manchester, and I was looking at a few blood results. The biggest one that stood out was the ALT, which is a marker for your liver. So it's an enzyme that's within your liver. And basically in Liverpool, I can't remember the numbers off the top of my head, but arbitrary units. So let's say it allowed this level to get up to 50 and that was classed as normal. In Cheshire, it was like 38. And why that's significant? A couple of reasons. One, it allows your liver to basically nearly go up to like, 40% off the top of my head, above what it would have been in another area before we intervene. So that's obviously bad in the first place because your liver doesn't really care about where you are geographically. And then the second thing was a lot of medication are cleared via the liver. So metabolized via the liver, excreted via the bile or the kidney, depending on how the drug is formulated essentially. And one popular drug, popular in terms of prescribed, unpopular in terms of its public opinion, are statins. So we use statins up until your liver gets to 3 times this level of enzyme. So in Liverpool, it might be 150. In Cheshire, it might be 116 or whatever it is, depending on what the actual upper limit is. But my point is, depending on where you are, we might stop treatment earlier, or your kidney and your liver, maybe getting more of a beating. And I just found that really strange. And then when I looked into it, it is population based. And then that's what I was trying to get across to this other person. Geographically, you need to know that a lot of these things aren't standardized and they are not optimal levels. We should be trying to get everything out of it. That is what this whole drive for longevity has been. It's been to get the body functioning as much as possible for as long as possible. That is basically longevity to me. It's not about living to a certain age. It's about living for longer in greater health. That is longevity if you had to define it. But yeah, a lot of these things aren't. But I'll think of some closing comments anyway. I'm going to do a set of wide grip pull-ups. I'm trying to get 8 and I don't know whether to do them normally or to actually take a long time on. I'm going to say I'm going to take a long time coming down, because then if I don't do 8, at least people can be like, oh, it's a bit harder doing it this way. So let's see. To be honest, I felt it in my back, but it wasn't as hard as I thought. I might try the opposite way this time. So I might try and hold it at the top and go normal pace. See how much harder that is. But yeah, I'll have to come up with a few more things that I want to go through. The whole point of these vlogs now is to be a bit more casual. I feel like the whole point of the channel is to give people a bit more information, a bit of transparency, but until you keep doing numerous videos, you find it hard as how to come across. So there was times when I was sitting there basically doing a lecture, which isn't that good for a lot of people, because even me, I like to watch certain people on YouTube. I've been watching a few more people again, see how they do certain things. And I like to watch stuff that are just easy to watch and maybe pick up a few things. So I thought by balancing a bit of healthcare, medicine, whatever it is, longevity, with a workout and going in between might be that perfect balance. But I just need to master how much to speak and when. Right, 2 more sets of this, and then go and get a nice shower, and then start with, I'm not religious, obviously, that's a different conversation, but you can't disprove it or prove it. But obviously Lent is coming up, I don't drink, I don't do anything outrageous anyway, but you can give stuff up for Lent, or apparently you can start things for Lent. So my partner, is she religious? Don't know, hit or miss. Her family are. So she's gonna try and get up early. So that is gonna be mine. 6:30 in the morning. That is what I wanna do. Right. 8 of these, holding at the top, normal pace, tempo, going everywhere else. Let's see how hard that is. That was a bit harder, probably a bit more tired. So this is not blood test related, but a few years ago, went on a mastermind event in Marbella, and we ended up going to this gym, Mike's Gym it was called. I think the man was like ex-Marine, ex-military. He's like in his 60s, I think. Absolutely insane what he's doing and how he's still going. But on that trip, I don't know what it was. I think I just didn't warm up properly. Obviously, being in a group of lads, you don't want to stop, all them things. And I sort of strained my bicep. And at the time, I didn't have this gym. So a lot of my training was barbell. So if I wanted to do a squat, I'd have to put 80, 100 kilos on, get it up from the floor, flip it over my head, do my squat, press it back over and get it off. And I think it was just using a straight bar plus or added to that workout or that boot camp day. And it just strained my bicep tendon here, and it didn't recover for ages, and I got to the point where I couldn't hang on here at full extension. Now, if you probably notice when you watch me pull-up form, it's completely changed. Where I used to sort of stop in this position, I go all the way down every single time now, and slowly it has strengthened back up, but it's took the best part of 2.5 years, 3 years nearly, to actually correct itself, which is absolutely insane. So yeah, training hopefully should go in a better direction now. Right, I will do these last reps and then close off and then think about the next video topic. Getting tired now. 2 more and gets me to 8. Was that a proper rep? Do 1 more, even if it's a half to make up for it. That was a half. 2 halves equal 1. Right, so upper workout done. A bit of thoughts on blood testing, why I think you should get it done, the evidence behind it, and yeah, just sadly people are brainwashed to still work within the health system and think that we should wait until people basically drop dead before we intervene, which I don't agree with. And that's something that I've done more and more over social media, and probably in life in general, is for years I've always stood up for what's right, always, or what I believe is right anyway. But I feel like online and in certain situations, because you're bound by governing bodies, you go, well, I'm not going to say that, or don't want to do that. Whereas now I'm like, well, I'm well within my rights to do it. And if I don't do it, I feel like there's more harm caused to other people. But yeah, these are more casual. If you've got any idea, or any ideas of any topics that I could go through whilst I'm doing a workout, by all means put them below. Obviously everything that I've said in this video is for informational purposes only. It's not medical advice. This is just to spur you on to go and do a bit more research. Don't really trust too many people on the internet. Just use it as a springboard to go, okay, well, I'll look into what he said and make your own informed decision. But as always, if you've got this far, thanks for watching, and I'll see you in the next one.